Okay, thank you, Jerry. We will call to order the August 20th meeting of the Board of Health. We are meeting at the Eastern Idaho Public Health Building, and the meeting is also being streamed live on the Public Health YouTube channel. Thank you, Jerry. We will call to order the August 20th meeting of the Board of Health. We are meeting at the Eastern Idaho Public Health Building, and the meeting is also being streamed live on the Public Health. We good again? Okay, after some technical difficulties, we are meeting as a Board of Health on August 20th at the Eastern Idaho Public Health Conference Room. The meeting is also streamed live on the YouTube channel in an effort to allow as many of the public as possible to be able to receive the information that will be presented today and to be a part of the meeting. I want to thank our director, as well as all of her IT staff and all of her administrative staff for the work that it takes to put a meeting together like this, to be able to stream it as well as be here. It's a considerable effort, and we appreciate all that they have done to be able to allow as much of the public as possible to participate in this meeting. We will begin with I guess rather than do a roll call, I'm just going to announce that in the building, we have Commissioner Leah Madsen from Lemhi County, Commissioner Shane Young from Jefferson County, Commissioner Blair Dance, Fremont County, Commissioner Greg Shenton from Clark County. We also have Commissioner Brent Mendenhall from Madison County and Commissioner Wayne Butts from Custer County. And I believe online we have Bill Lake from Teton County. Are you able to hear us, Bill? It appears.
Yes, Brian, I can hear you. Thank you.
Okay, thank you. We appreciate you joining us remotely. So we do have a full board meeting with us today. We also have, of course, our director, Jerry Rakow, as well as many of the division directors and our fiscal officer, many who will be reporting later today. We'll go ahead and begin with our consent agenda. On that, we have our minutes from June 3rd, as well as the subgrant review and approval. Those items were made available to the board members. Are there any questions? Seeing none, I would entertain a motion to approve both of those items. Okay, we have a motion. Do I have a second?
Second, Commissioner Dance.
Okay, we have a second by Commissioner Dance. Any discussion on the motion? All in favor, say aye.
Aye.
Is there anyone opposed? All right, thank you. We will move next, I believe. We will move next to Dr. Christine Hahn, our Idaho State epidemiologist. We are very fortunate to have her with us this morning to be able to give us a statewide assessment and to be able to provide us information. Dr. Hahn, we realize how valuable your time is, and so we very much appreciate you taking it to share with us this morning. And we'll go ahead and turn the time over to you.
Thank you so much. Can you hear me, and can you, oh, hang on. Can you see my screen now that I've actually tried to share it?
Yes, we are
Okay.
seeing your shared screen and we hear you just fine. So thank you again.
Great. Well, thank you. And I'm so happy to be here. And I know that I have, it looks like about 15 slides or so to talk through, but I know there maybe I'm able to stay afterwards, and I know there'll be some more presentations from your local health district and maybe others, and I'm happy to stay for that conversation as well. But at least hopefully this gives some background to where some of the concerns we have at the state level right now. So I know you are well aware in the country, this is where we were last winter with this huge peak in cases, and we are starting to see a similar rise this I would say fall, but it's not. We're still in summer, really. So we're starting to see a rise much earlier than I think we expected. Also correlating with that, of course, this is all national data right now. This is from CDC. We see a rise in hospitalizations, I know, impacting that you are well aware of throughout the country. Looking at age groups, I just want to mention that nationwide, they're actually seeing a higher hospitalization right now in children. So this is CDC data looking at age 0 through 17 overall hospitalized. And if you look at on the right graph here, you'll see that kids barely make a dent. And that's why we always talk about, this disease impacts adults much more severely in general than it does children. But if you look at that golden line at the bottom, it doesn't look very impressive, but just pulling out kids and looking at them, even though it is still rare for children to have to be hospitalized, that number is higher than it was even right now than it was during the peak. And why that is not completely clear, but I think most people think it's just a function of more kids getting infected because this Delta is so transmissible. So a certain percent of them ending up in the hospital. This is the Idaho data right now from the national perspective. I just wanted to show it to you to see that we are not at present seeing a significant rise. We've heard some providers saying in the Boise area, for example, that they are seeing more kids, but of course they're a referral center and they might be seeing a little bit more of that impact. But overall, we have not yet seen a rise in children, which we're very, very grateful for, even though I'll show you some data showing that we're overall seeing rise in our numbers, and we of course are worried about every age group. This is our case rates. So these are just cases detected through lab testing, usually that get reported to our local public health departments, and they report them on to us. And you can see here we had a big spike, just 2 days ago that I think took us all a little bit by surprise, of over 1,200 cases reported. Not where we were last winter and fall, but certainly a concerning rise, especially now with fall coming on and schools reopening and so forth. We didn't want to be in this place. Just for comparison, I looked at where were we exactly a year prior, and you can see last August, mid to late August, we were actually still on a downward trajectory and at a much lower number overall. So even though we did eventually see that fall surge, I just kind of want to make that point that we are ahead of the curve, if you will, going into school reopening. These are our hospitalizations and ICU numbers, and this is all available to all these Idaho data is on coronavirus.idaho.gov. If you you can look at these. I look at these every day to kind of make sure I'm seeing all the data that my team is producing and how it looks publicly. This is our data dashboard, all this data. So you can see here that even in early July, we had 74 folks in the hospital with confirmed or suspected COVID. And as of just a few days ago, we were at 377. We do have a bit of a lag, you'll notice, in the hospital data because we need to make sure we get a report in, a lab report, and sometimes it takes a few days for that data to get for that case to be confirmed as hospitalized. We do have a little bit of a lag there, you'll notice. So we're probably actually a little higher than this by now, but we had 377 people in the hospital and 120 in intensive care as of just a few days ago. I also receive through our preparedness program, we see the number of people on ventilators. Obviously, all of these would be in intensive care, but it's a subset of those people. And you can see, again, this confirms that feel. If you look at this was late June, early July, very few. And now we are up to, over 70 people on ventilators. So all pointing in the same direction. So why is this? We've all heard about the Delta variant being thought to play a large role. And so I'm just going to say a few words about the Delta variant. First of all, just this is a site I like to go to that has great ways of comparing data across countries. It's called Our World in Data. And they pull data off from various countries' websites. You always have to think about how great is that data. So I try to use countries that we know have robust public health systems like Canada. We all know that India recently had the surge, and you can see Delta that rose there, causing huge problems there in their healthcare capacity. Those numbers have started to come down, we know, but you can see that the Delta percentage remains high. United Kingdom, same pattern, United States, and now Canada not far behind. So Delta has really swept around the globe. So the Delta variant, how is it impacting the way the vaccine works? And I think the bottom line, and I'll go through this quickly, is study after study is confirming that the vaccines do not work as well against Delta, but they still work. And I just saw it this morning, and I threw this slide in, so it's not very pretty, but a study that just was made available for the public to look at has not actually even been published yet, but I was able to read through it. It's out of the United Kingdom, and it showed what we're seeing from other studies too. They said that what they found was the vaccines did not work as well against the Delta virus, and people that get vaccine breakthrough cases that still get infected with Delta, they can still have a high burden in their nose, but reassuring to those of us that have been immunized, they still are showing good protection against ending up very sick. They'll still protect you from getting in the hospital or dying from COVID. Very, very good protection. So this is similar to what we've seen from previous studies out of the United States. So this is kind of what you've been hearing, hopefully, in the last several weeks as people have started to publish about the Delta. So it's not 100% protective. I know we've all gotten pretty adept at thinking about what are some good analogies for people to say, well, I hear the vaccine, you can still get COVID. I think of seatbelts as probably my favorite analogy. I put a seatbelt on, even though I know it doesn't mean I absolutely won't get injured in a car accident. It doesn't mean absolutely I won't die if I get in a car accident, but I know it'll reduce my chances. And in the same way, this vaccine, yes, you might still end up getting infected. You might still end up getting sick, but your chance of getting severely sick or dying with COVID is greatly reduced. And that data continues to be robust. I'll talk a little more about the boosters and some other questions with vaccines later on, because I know that you guys probably have questions about that. This is an infographic we've been putting out. You may have seen looking at our COVID cases, just recent COVID cases from May through July when the vaccine's been out there for a while. What we're still finding is that the vast majority of our cases, the vast majority of people that end up in the hospital with COVID, and the vast majority of people dying of COVID are unvaccinated people. So we know that if you are vaccinated, you are very unlikely to end up, especially what people are most concerned about, hospitalized or dying of COVID. So that's incredibly reassuring, I think, to people that have been, or should be reassuring to people who have been vaccinated. This is an infographic from CDC, and I like it because it's so simple. I think sometimes I love graphs and data and charts, and I think sometimes people it's too much, but this is a very basic depiction of what do we know about how is Delta different. What we know is that if you're infected with the original COVID strain, on average, you infected one or two other people. So the outbreak progressed. We saw outbreaks slowly moving through populations, but now with Delta, you tend to infect more like, depending on which study, 5, 6 or more other people. Suddenly those 5, 6 or more other people are infecting 5 or 6 more. And that's why we're seeing these rapid rises and rapid, just because we know it's more transmissible. There's conflicting information still, and not completely clear yet of whether if you get infected with COVID, is it that much worse? Is your risk that much higher? There's different information about that. But what we do know is that it's more transmissible. So therefore, there are going to be more people, even if it's still the same virulence. If you have more people infected, obviously in 1%, let's say, end up in the hospital, that's going to still push up the burden on the hospitals as they see these patients coming in. So turning to vaccination, we know that we are in the lower end of the vaccine doses administered. Some of this has to do with the fact that we have a younger population than other states. Because we have a younger population, we've had all along fewer people eligible per 100,000 because, of course, the vaccine was initially not recommended for younger people and not authorized for anybody, and certainly remains not authorized for those under 12. So part of this isn't our fault, if you will, but it's still a fact that this means this virus has more unvaccinated people to circulate in, and it is going to impact us. And of course, we've already seen in the South here with some of the other areas with lower vaccination rates, large outbreaks and large pressures on their hospitals already occurring. We know, of course, this isn't even throughout the state. You all have some counties with really good vaccination rates, relatively speaking. Of course, would like to see them higher, because we do worry about those large numbers that remain unvaccinated. But you can see how uneven it is throughout the state. And of course, we are all continuing to message that our best way out of this pandemic continues to be vaccination. And this is all also available on that everything I'm showing you, that state data, again, is on our coronavirus.idaho.gov site and updated daily during the week. So I'll stop my remarks other than a couple summary slides or conclusion slides. One is that we're very concerned about our increase, and I say fall increase, but I feel like fall is here since school has started. We are worried about the cases that we're seeing increasing in hospitalizations. I think you're going to hear from the hospital, so I'll let them speak for themselves. But just to say that we are very concerned about it. We're worried about the low numbers of people vaccinated against COVID, especially in certain counties and certain parts of our state, that there's just a large unprotected population there. Our increasing numbers also, it feels like last year we had more people masking. We had more of orders in place, of course, to do so. And there were more closures and that type of thing. So we're worried that now the virus is going to be, because people are getting together more and not masking, that we're going to have more transmission, especially going into fall. The other thing I want to quick mention is we already see an increase in respiratory syncytial virus. This is a virus that particularly affects young kids severely, but can affect all ages. We are already seeing increases in that, which is very unusual for this time of year. Usually doesn't pop up until late fall. And that's been seen in other states as well and is contributing to the hospital burden. And we are concerned, of course, that we may see the same as influenza this fall. Didn't happen last year, maybe partly because of some of those restrictions I mentioned earlier, but we are very worried about other viruses resurging at the same time. I want to just close with a few current challenges. I think kind of trying to think of the biggest challenge we're facing right now. So we just received approval. I know you're probably all aware that certain immune compromised people have now been authorized and recommended to get a third dose of the vaccine because they don't mount a very good, studies have shown they don't mount a very good immune response in the first place. It's a little different than boosting because they never really had an immune response. So they're just getting a third dose to try to get them to get an immune response. So that is a new effort going out there. We're hoping that most of those folks are availing themselves through pharmacies, clinics, the health district. I'll let Jerry speak to, I know they do great work in vaccinating the community. The second challenge now is this announcement by the White House that all of us who received initial series of the mRNA vaccine, so Pfizer and Moderna, that all of us should get a booster. And this was, I'll just be frank, this was a bit of a backwards. Usually those recommendations come from CDC through their advisory committee. So it came out from the White House and their team, and now CDC is going back their advisory committee, I actually was on a call yesterday, is now looking at all that data and trying to create a robust recommendation. So to be clear, if you guys get questions, right now, the booster dose is not authorized by FDA, and it is not yet recommended by CDC. So the White House kind of said, we have a recommendation and we're hoping to have it really in place and implemented by September 20th. So we'll see, but please stay tuned with that. It's a bit confusing, and I don't think the way that at least the CDC team would have liked to see it get rolled out. So if you get questions right now, and I already have, you may have already, if you get questions about that booster dose for people who are not immune compromised, just saying, hey, I hear that I might need a booster dose at about 8 months after my series. That has not been nailed down yet, but we are certainly working very hard on getting a recommendation out there, and CDC will certainly have something out there in the coming weeks. Lastly, I want to mention, Jerry asked me to talk a little bit about the treatments. Monoclonal antibodies are something that we are working very hard to increase the use of in Idaho. I will say your eastern part of the state actually does a better job than other parts of our state as far as using this. These are, I always relate it back to if you ever traveled and you had to remember getting an immune globulin shot before travel to prevent hepatitis. This is a very similar concept where you're taking antibodies and you're giving them to people who are actually already sick, but just mildly sick. You can also give it as a prophylaxis measure now. FDA has authorized that, and you can keep people out of the hospital. And anything we can do to make sure those are being used to their fullest per the regulations, we want to do, because that will help reduce burden on hospitals. So we're working hard with the hospitals right now to try to see how we can increase use of that. And I'm sure if there are folks here from the hospital speaking to you today, they can mention there are challenges, especially staffing that type of treatment. I want to mention as my last couple challenges, school openings, of course, I've already mentioned. I'm a parent of 2 kids in the Boise school system, and I've already gotten 2 emails about cases of COVID in their school, and they just started Monday. So we're off and running. We're very worried about, of course, we want to keep schools open. We all want our kids to stay in school. So that's going to be an ongoing work. And then lastly, we are talking to hospitals this week. Yesterday, our Crisis Standards of Care Activation Committee met for the first time in many months, just to talk about what the processes are, if a hospital actually requests to have a Crisis Standards of Care declared for them. And I've put in a couple links here. They are on the Health and Welfare website. You can look and find information about that. But that would allow, if that is declared, that allows a legal framework for hospitals to provide other than their usual standards of care, because they simply cannot, they've declared that they simply cannot adhere to all the normal standards of care. So obviously a very extreme measure that we hope we do not have to use. So I'll leave it at that. And Jerry, I don't know if there's more you want to add, or if you want to let your folks speak, but I'll just turn it back over to the, I guess, to the chair, and I'm available for questions, or like I said, I'm happy to stick around and be part of a later conversation.
Okay, thank you, Dr. Hahn. Are there questions from board members?
Dr. Hahn, there is one question from Bill Lake. Is Idaho able to track the number of infections that are the Delta variant?
Yeah, thank you for that question. The short answer is no, but we do have a sense of it. And I'll tell you why. Many tests that are positive don't get sent to our state lab. Our state lab is the only one doing that. Well, I shouldn't say that. They are the major lab doing that sequencing work right now. And if the samples don't get forwarded, for example, then they can't do that work. Also, sometimes, even though it gets forwarded, there's not enough genetic material in that swab to do that full sequencing, so they can't sequence it. In addition, there's a lot of work, and they actually use partner labs to help them to try to catch up. So we don't know for every case, but they are testing enough that we are fairly confident that about 90% of our cases right now are Delta.
And Bill, as we go through the data dashboard, we can show you where that is recorded as far as what has been laboratory confirmed both in the state and in our health district.
Dr. Hahn, this is Brian Reed. Do you have any sense or understanding why we are seeing more RSV and so early?
Yeah, thank you, Brian. That is a great question. We don't really know, when we think about viruses, how they tend to be seasonal, they tend to go up and down. And each virus is a little bit different, but obviously flu, RSV, there are other what we call respiratory seasonal viruses that tend to usually go up in the fall and winter. And the reasons for that have generally been presumed to be more crowding. Everybody's going back inside, temperature differences, even humidity differences, drier air. Some viruses tend to float better, if you will, in drier air. So this year, the thinking is that those viruses were very suppressed last year, maybe because of social distancing, masking, kids staying home, and maybe those viruses got suppressed to the point where that little bit of natural immunity that kind of gets through a population might have been suppressed last year and there's less immunity. But that said, no, it's not clear yet why this is happening. It is a surprise, and I'm sure there are people trying to understand it better because this is very unusual.
Yeah, unusual and concerning because of
Yeah.
how hard that can be on the children.
Totally.
Are there other questions for Dr. Hahn? Go ahead, Commissioner.
And I apologize, I could not hear the commissioner, so if someone could repeat the question. Now I can hear you better, yeah.
Do you have any idea what our hospitalization rate is with Delta variant?
Is the question what our hospitalization rate is?
With the Delta variant.
Oh, with the Delta variant. Okay, thank you. And I'm sorry. Yeah. No, again, as I mentioned, we try to sequence, we have requested every lab, including the hospital labs, to send us their positives so that we can try to get that better sense. But we can't, and Idaho is not alone. Every state is struggling with this. We cannot sequence every case. So we can't really say, like in our hospitalized cases, how many of them are Delta. Our first guess would be it'd be similar to what we're seeing in the community, which is at least 90% of them. But we don't know if it's maybe a little higher or lower than that. We don't actually know that.
Okay, thank you. Other questions?
Dr.
Right.
Hahn, I was just going to say thank you, first of all, for your presentation. And if you are able to stay on while we continue the COVID discussion, that would be great. But if you have to drop off, we understand that too.
Thank you. I am going to run to the restroom real quick and then I'll be back. I'll be back on. Okay.
Thank you.
Thank you. And I'll stop sharing here.
All right. We will go ahead and move then to our epidemiologist and our Division Director of Community Health, James Corbett.
Thank you, Commissioner Reed. So we'll just,
Sorry, I'm just trying to get off.
you're okay.
Are we okay with volume on the YouTube? You might want to put that right in front of you.
Yeah, I'll certainly try to speak into the microphone. So I'm going to take a little bit of extra time here today and go through what we have on our website and some of the, thank you, Jerry, some of the sharing of what we have in our data and what that may mean. What I'm hoping this to be is kind of elicit a discussion amongst, so if any questions pop up during the time, really all of the information is on our website, but I hope that we have the ability to go through and do that. So I apologize. I have to look off my screen for just a minute to share.
The right.
Thanks. I can't see very well. Okay. So we have it pulled up.
The dashboard, probably not.
Yeah.
That's not it. Oh, yeah, that could be it.
Is this one it? No. I apologize. We'll go here. Actually, what I'll do is,
It's to the left there. You can, the very left tab. Up.
I can't quite see it here. Is the screen's up there?
It's
Okay.
already open up.
Oh, it is.
Their top left tab.
Thank you. Okay. So we're going to go through our website, and I'm just going to pull this up to a great deal here. And we're going to go through each of the tabs that we have. We work pretty hard on this to make sure that we update it consistently on a daily basis. It's not updated on Saturday or Sunday, but it is updated with the current numbers for Saturday and Sunday on Monday. Yep. So we will, I'll kind of take you through tab by tab of our BI case dashboard, and just again, kind of orient individuals in the community, but also all of us to it, and then what information we can glean from that. So again, let that be an overview or an illicit discussion. So again, this is our kind of landing page. This has been the same. Individuals have liked kind of seeing a snapshot from a table of where we might be each day. We look at the total overall cases, what's confirmed and what's probable. I'll just take a moment there. Probable, again, can be two different items. One, it can be an antigen test, or as well, it can be individuals that have symptoms that have been in contact with a confirmed case, and they talk with our disease investigators and epidemiologists here, and they can be determined to be a probable as well if they are having symptoms that are consistent. So again, total cases on the left, number of released cases, active cases. Again, we define active cases as those still within their 10-day quarantine period. And then certainly today's cases, hospitalized residents. I'll just take a moment and we'll see this a little bit more. There's certainly, our hospitals are certainly treating more than just our residents. However, Dr. Hahn mentioned this, that we don't always get to see that data until a little bit later, just of the reporting requirements. So we've chosen not to necessarily put that on our website, but just know that our hospitals are regional hospitals and they treat more than just our residents. And then sadly, we display the deaths that have occurred due or in part to COVID-19. So moving on to our second page, this is really the county level data, and it defaults just in alphabetical order. In the top right here, we can choose the county that you'd like to see. It has its county data, just really similar to what we showed on the previous page. And then as well as instant number of cases. On most pages, we have a slicer or a time slicer. As you slice this data, you can update it and see what's been more recently. And again, that graph will update. So you can zoom in and really look over. If we go on to the next page here, this is district level data. It has both the slicer, but you can see the total cases here. And the daily counts here are shown. But you can also move it to a weekly count that we just added. And I want to show this. This kind of helps to provide a picture of really what our, kind of without looking at all the daily incidents back and forth, it can really kind of provide a kind of a cleaner picture of where the peaks and valleys might have been. So you can see last August, first part of August, we had a little bit of a peak, a little low right before kind of around Labor Day. That could have been due to reporting. And we didn't really see a decrease because we noticed as well, you'll notice that there's some artificial decreases right around Christmas time right here. And then right at Thanksgiving time right here. Individuals were really not as forthcoming with testing and going and getting testing during those times, as well as just a delay in reporting from some of the labs. So that this Labor Day could be attributed to a little small bump as well. And I'll come back to that in just a moment. So again, this weekly case count can really kind of clean up where we saw peaks. So this is our demographics page. Again, I want to highlight here, this is something that Dr. Hahn just mentioned, as well as other individuals have asked quite a bit about. Where does it affect lately? Or where is it most occurring? What age group? If you hover over these age groups, again, I'm just going to point out here, we're looking at all counties in this instance. Here you can actually select individual county or combined counties if you'd like to. So you can have multiple options. There, I'm just going to select Bonneville County, or you can select Bonneville and Jefferson. This way, but again, right here, we'll select all. If you hover over this age group, you'll see that of the total number of cases, 9,492 were in this 18 to 29-year-old, contributing to 31.89%. Now, if we slice this data down to, let's say, just this is small, I apologize. So it's hard to see at times. That you can hover over again over that age group, and it's a very similar percentage, right? 28.62 or 397 during this age group, which looks to be about June 24th. Again, it's small on my screen. I apologize. So I'm going to hover over here. You can see that actually it changed just slightly, but the bars changing don't necessarily mean as you need to pay attention to the numbers. They do mean something, but it means to take a closer look. So we're going to look at two of these things here just in detail. 13 to 17-year-olds since June 24th attributed to 3.75% of the overall cases, where 5 to 12-year-olds, excuse me, are 4.9%. So again, if we slice this back out to the entire picture, normally 13 to 17-year-olds were slightly higher at 5.75, and 5 to 12-year-olds were slightly lower, actually 4%. There's many reasons. Dr. Hahn kind of showed a curve where the increased cases were going in the younger individuals. I also think that's attributable to the vaccine being made available to 13 to 17-year-olds and not to 5 to 12-year-olds at this moment. So a slight change in that demographic of who's catching it, and at least attributable somewhat, from my opinion, from the vaccine. So again, you can select individual counties. I'll select Madison County, for example, here. And you can see that, most of their cases are driven by 18 to 29-year-olds. In fact, 66% overall. Interesting enough, if we slice down to like the last, we'll say month time frame, that's 2 months actually, I think. The last month's time frame, you can see that the 18 to 29-year-olds don't account for as many. So 48, almost 49%, where we're having an uptick in some of the other things. Now, you could attribute that maybe to the college being off track during that time as well. So again, you can see really and delve into some of this data, what age groups are happening. So any questions on any of these pages or elicit thoughts that you might have? I'm going to kind of stop before I move on. Again, some really good information if you want to go. Now, this next slide page really is kind of building out the data if you want to in any way you can imagine, really. We have the total number of cases here. You will see that it's slightly lower than our total amount. I'll just remind you, we exclude 90-year-olds and above, partially due to privacy issues. We don't, there's not as many 90-year-olds, and we wanted to be cautious about people being identified. So that's where we've made that change. But again, if you click on this little plus sign on the cases, you can really choose county or city or age group. We've added 2 items, vaccination history and hospitalizations. So if you click on the vaccination history, you can see this not applicable and it has the most. We did not select, started tracking vaccinations until the 1st of May. That's really when most of the population had an opportunity to receive both doses if needed. So again, the data is from the 1st of May. Everyone before the 1st of May that did not have a vaccine, we chose to put into the not applicable. You can see that by if we slice this data down again. I'm just going to slice this data down again into the May timeframe. You can see now that not applicable, there's a few left that we have to try to clean up here, but you can see not vaccinated, fully vaccinated, and partially vaccinated. And you can really determine from, here's your denominator under cases, and then looking at not vaccinated versus fully vaccinated. And you can slice that down. You can even go further, again, to choose something else. You can exit out of the vaccination history up here. You can choose by county. And then we're going to look at Bonneville. Again, this order will always be in the order of most to least. Underneath that, we can choose age group. And you can see that here's our age group. Sometimes there will be slight drop down arrows here. If not everything can fit on a page, we apologize. We wish that wasn't the case, but to make it readable, we continue to kind of keep that same uniform look. So you may have to use those scroll up and down buttons right there. And then inside that, you can look at vaccination history. So looking at 18 to 29-year-olds, you can see that, if you highlight over here, it'll pop up with the number of cases and the fully vaccinated. So out of the 220, 169 were not vaccinated, 21 were fully vaccinated, and 7 were partially vaccinated. And again, there's a little bit of cleanup that we're still doing on all of those things. So again, you can slice the data and pick and choose really how you want it and really get information if whatever you'd like. On here, we look at just hospitalized cases. Again, I'll orient to the county. You can choose all or some or multiples. You can slice the data and you can see which age group is being hospitalized. I'll just point out again, the percentages here. So overall, but if you wanted to say, oh, let's look, I'm just going to do it the other way now. Instead of slicing forward, we'll slice rearwards until February 1st. What were the percentages of hospitalizations? And we'll just look at 70 to 79-year-olds for an example. Just under 25% for the 70 to 79. And then I'll try to, and then you could slice it the other way. Till January, kind of first part of February there. And you can see that we've had now only 18.72 during that time. So again, a less likelihood, and that's skewed younger. Again, as age increases, so does the vaccination uptake. So again, I would attribute this shift downwards really to the vaccination uptake and the job that the vaccine is doing of preventing hospitalization and disease, severe disease. Death demographics, again, this is just overall of the 271 deaths. What are those demographics and age groups? We don't have a slicing agent in here. There's not too many cases to necessarily look at that, but again, you can pick and choose actually on the case detail page if you want more information. Healthcare infrastructure. This is actually the report from HHS for our regional hospitals on what they report of staffed, and the hospitals can report on this more in a moment, but that the 3-day average of staffed inpatient beds and what they're occupied, you can see that's fairly consistent, a slight upward trend over this last time. More variability and volatility in the ICU daily staffed beds. As you can see, back in September, they were going above us staffed beds. Getting up into the November, December, they were very close. And again, we're closer. Again, now we're at 90, slightly downwards, but again, hovering where we're concerned, where the hospitals are concerned. This is what Jerry referenced earlier about our variants that have been identified by the Idaho Bureau of Labs and notified to Eastern Idaho Public Health. So we just have the variants of concern listed up here across this top, and then going down by county and which one you could see. So Delta being found in Bonneville and Lemhi for a total of 8. Now, I just want to caution, while it only reports those sequence, I'll just reiterate what Dr. Hahn mentioned. We only sequence, we don't sequence every sample. It's a very small, really, in the grand scheme of things, sample size. So this is likely much greater, but we don't have all of the numbers. What I would say is, of the sequencing done, the last week and a half, it's been 90% Delta variant across the state. So that's where she came up with that number, where they kind of extrapolate that out. That's probably closer to reality than the 8 that we have shown here. Again, this graph right here is a number of tests in the blue bars being conducted, and then percent positivity, the line. So right now, the latest data that we have, 13% of the tests were positive that are being run in our community. Again, that's also a sampling. That's only to get a good denominator. That's only the tests counted if both the negatives and positives from the labs are sent to the Idaho Bureau of Labs. So if a doctor's office is only providing positives, those don't go into positives or negative numbers. We're just taking the samples that are from labs that send us both negative and positives. So slightly decreased amount of tests conducted in this last week. And then the last tab that we just added was vaccine breakthroughs. So this has some increased data here that you can look and see as a snapshot. Again, you can go back to the case detail page and kind of slice the data your way, however you'd like to look at it. But again, putting together some graphs and details for individuals that just want a snapshot. We have 85,193 individuals in our district that are fully vaccinated. We've had 327 fully vaccinated cases. The average days from vaccination to the positive test, 114. That day is going to fluctuate as it goes through. So again, that's, but it is something that we look at. 14 have been hospitalized ever for their COVID-19. And then we've had 4 deaths related to COVID-19 that have been in fully vaccinated individuals. Now, this isn't something that we can easily get, so we don't display it. The immunocompromised status of those individuals, and it's hard to display that and get it on a routine and a relevant timeline. So we choose not to display it. I wish we could. So I know that's a common question we get. We are not able to. Something that is interesting as we delved into the data, though, the average age of the vaccinated cases are higher. And as we know, as we increase in age, we do have slightly more chance of getting other, immunocompromising conditions or other diseases that would affect this. So the average age of non-vaccinated cases being lower. The percent of non-vaccinated cases immunocompromised, this is just a general percentage that we are able to get. So we can't get necessarily timely, but we can look kind of historically. And this really points out what kind of percentages we're looking at for decrease and how effective the vaccine might be working. The percent of non-vaccinated cases immunocompromised, 3.5%. The percent of vaccinated cases immunocompromised, 13%. So again, you can see, you'd expect those numbers to be equal if the vaccine wasn't working. But again, it is working for for most everyone. Individuals that are immunocompromised do still have a higher chance of getting the disease with the vaccine. And that's where you've heard about the third dose. And I know Amy will probably talk about that later on in greater detail. But again, that's where the third dose that was just announced, that's kind of commonly talked about as a booster dose. That's not necessarily a booster dose for immunocompromised individuals. They like to really use the term series augmentation for the fact that they're still in their primary series is really what that CDC announcement was made for. They noticed with certain immunocompromising conditions that they don't convert or they don't build up enough antibodies. So instead of a booster dose, it's really for these certain immunocompromising conditions, they need a third dose 6 months after their second one. So it's really just an extension on that series, not a booster dose. The booster dose really would come for normal public, again, as Dr. Hahn mentioned with the White House, September 20th. And again, we're hoping that gives HHS and FDA and CDC time to really talk about multiple things that would be beneficial to know. Co-administration of flu vaccine as we're getting into these respiratory illness seasons and some of those items, and really come out with some strong recommendations.
James, before you move on,
Yeah.
could you just show them how to display the data in a table?
Oh, yeah, thank you. So on any graphs, if you want to see that data in a table and even maybe copy and paste it over into an Excel file if some individuals want to, if you right click on the graph, it will bring up and say show as table. This one is actually a great one because it's very hard to hover over this and maybe see I'll just say the light purple is total cases and the dark purple is breakthrough cases. You can slice this down, and I'll take that opportunity to do so just in the last month. So you can see it just slightly easier, I guess, if it wants to. It appears it may have been, it didn't like what I said,
There,
apparently.
you might, it looked like it might have refreshed.
Oh, did it? So we'll leave that for a moment, and I'll come back to it as it's waking up slightly. So again, hospitalizations, percent of non-vaccinated cases hospitalized since May. Again, we chose that May date to give every opportunity for most individuals to have access to the vaccine if they chose to. So since that time, percent of non-vaccinated cases hospitalized, 5.3%. Percent of vaccinated cases hospitalized since May, 1.2%. So just doing a quick math there, about 4 times more likely to be hospitalized in those times. And that's kind of consistent with what the statewide data is. Again, that's similar to what we're seeing. So I apologize that it's not slicing there, but if you do right click, you can say show as table, and it'll bring up both the graph and then the table. And then you can actually scroll down through, and I'm just going to scroll kind of towards the end here, where we start seeing the total number of the cases, all incident cases here on the right, and then vaccine breakthroughs. And you can see that we are starting to see, an increased breakthrough. One other,
James,
yes,
can I ask a question there that's been on my mind?
Absolutely.
So it appears that we're seeing more breakthroughs since this Delta variant
yeah,
has become more prevalent.
yes. Yeah, what we don't really know as well, and I don't want to read too much into the data, and I know that's frustrating. It's frustrating for me. I'd like to just be able to have the answers. We've also seen an increase in cases as those breakthroughs. So is it directly attributable to the Delta variant, or is it, we just see it kind of keeps that same percentage all along of vaccine break, as well as there's another factor of time since vaccination that we're also looking at. So time since vaccination plus increasing overall cases yeah, we have seen more breakthroughs, but is it due to one of those two, or is it due to the Delta variant? So there's a couple variables in there that I can't necessarily tie one of them. Chances are it's attributable to all three of those things. The vaccine we know is maybe not as effective as against the Delta variant as it was against some of the previous variants. Still very good, but not quite as good. Add in more cases and more people are going to be exposed, as well as time from vaccination. Again, not for sure, but certainly it's something that we're watching closely because it is a concerning trend. So one last thing, I'm going to give this back to you. Just allow me to share my screen if you don't mind stopping that share. Something that we're monitoring. I'm going to share my window now here. You can see on this just graph that I have displayed, this is not on our BI or our dashboard, but this isn't the whole entire year. This is kind of weeks, the week number here. So kind of from the middle of the year to the end of the year, you can see what we experienced in 2020, this blue line. From that blue line, we've added the 2021 data. And I'm not going to read into this too much, but it is following a similar trend line. That could indicate some seasonality, as Dr. Hahn talked about previously. Some viruses have some seasonality. It also could be human behavior. But it is a concerning line that we're looking at. If this continues to increase on this same trajectory, and then we have the Delta variant that Dr. Hahn kind of showed that general picture of, that it could be detrimental to the hospital capacity. Now, again, I'm hoping and it's my great hope that you can see us leveling off in the last 2 weeks. I can say this week it's slightly increased to similar, so not a great deal. But I'm hopeful that we make a downturn and we don't continue on this thing. I'm not saying that we're going to go on this same trajectory. I want that to be clear. I'm not saying that at all, but we are seeing some sort of regular thing. And if we do have increased cases and schools go back into session, and there could be an opportunity for kind of some explosive growth. I want to highlight one other thing, and again, you feel free to interrupt me at any time. We are seeing kind of this more slow and steady growth. If you look at the rest of Idaho's data, they are seeing a much sharper increase. So we have been fortunate in our area to have this slower, steady growth. I mean, I'd take a decrease by all means, but if we're going to have growth, I'd much rather have it kind of this slow, steady. I'm going to remind everyone, in March and April, our region specifically, and the rest of the state excluded, had an increase in cases. We were the only district in the state that had this fairly significant bump in March and April. I don't think it's a coincidence that now we're seeing more slow and steady growth, where we may have a little bit more recency of disease within our community. So I think that's partially in this slow and steady growth is partially in responsibility or in relationship to that kind of sharp increase we saw in March and April, where the rest of the state did not. And they're seeing a sharp increase. I think what it goes to show is COVID, regardless of anything, will impact the community if we're not careful.
Can we turn time over to Casey? Let him give
Yeah.
the hospital report
Yeah,
and then come
absolutely.
back and finish.
Yeah.
Hi, can you hear me?
Yes, we can. Casey, go ahead.
Okay, I sincerely apologize. I'm trying to be in 3 places at one time and had to jump in my truck. So I will be reporting for Madison, Ermac, and ourselves. Currently, Madison is seeing 3 to 5 COVID inpatients a day. They have seen an increase in testing demand. They were able to get some help from Eastern Idaho Public Health on testing medium to meet that increased need. She was in contact with Keith Nagy over at Teton Valley, and they've been very desperate for testing materials this week. So I know they're struggling to keep up with the demand. Madison is reporting that they're continuing to face staffing issues that limit their ability to bring on additional patients, and consequently, we have received, and I know David has as well, some of the patients from Madison. Ermac right now is currently at 17 COVID patients in-house right now. 9 of those are in the ICU. Their vent utilization currently is at 70%, so they're using 70% of their ventilators right now. David reports that that's not abnormal, but it is in the high range of normal. They're currently not experiencing any supply issues, but as Dr. Hahn mentioned, staffing is their biggest concern. They have been at near capacity several times recently with the influx of summer trauma patients as well. At Idaho Falls Community Hospital, we currently have 15 COVID patients in-house right now, with 3 of those in the ICU. Our vent utilization right now is at 42%, but we've recently been as high as 60% on our ventilator utilization. Due to the lack of beds available in the Northwest region of the United States, we've accepted several patients from Washington and Northern and Southern Idaho, both COVID and non-COVID patients. So there, a lot of hospitals north and west of us are experiencing such an influx of patients that they're at capacity and they're having to ship us patients. And unfortunately, they're having to go as far as Idaho Falls to find a hospital that has capacity to take those patients in. We're currently not experiencing any supply issues, but staffing is definitely our limiting factor. Right now, we're sitting at about 90% capacity, and that's based on staffing alone. And then lastly, I ran a report yesterday for the last 4 weeks, and 21% of the patients that we're seeing in the ED are COVID positive. So we are seeing quite a bit of people coming in, not as many as in the larger spikes towards the end of 2020 and the beginning of 21 that are needing hospitalization. But we are seeing quite a larger increase in the people presenting in the emergency room that are COVID positive. Are there any questions I can answer?
Casey, this is Brian Reed. I appreciate you being here. I want you to clarify for me what you just said. Did I understand it correctly? Are they presenting at the emergency room because of COVID symptoms, or are they coming for other reasons, and then when you test them, they're COVID positive?
No, they're presenting for COVID symptoms, or they're already known COVID and they're coming in with complications from their illness.
Okay, I wanted to make sure that that was clear. Is there other questions, Mr. Jackman? All right, we appreciate you being here. Sorry, we're running a little bit late, and but we appreciate you dividing your time.
You bet. I apologize for the tightness of my schedule.
No problem.
Thank you, Casey.
Thank you.
Okay, we'll let you go ahead and finish up, James.
Thank you. And thanks to our hospitals for the report, and just overall their partnership. All of them are helping us with the vaccination effort as well. I will kind of share at this time maybe, and I know Amy will talk on this more later, but I do want to share just the vaccine data dashboard on the state's website. I can, that's okay here. You can see here that the dashboard from on the state website does go in. I've selected down here Eastern, so it's just looking at our health district. And if any individuals want to kind of combine this data with the data that we're seeing, you can look at kind of the age breakdown of the percentages of individuals who are vaccinated. Again, broken out by 12 to 64 and at least one dose and complete doses, and then 65 and older, going a little bit more. I do want to just show, and Dr. Hahn did show this earlier, so this graph a little bit earlier, this map on the left. But I just want to highlight the good work that our partners and even Eastern Idaho Public Health's immunization program is doing in at least increasing the vaccination rate and getting out to those individuals that want the vaccine. Certainly everyone, has their choice on this, but again, you can look at each individual county here and the percentages of the vaccination for everyone 12 and plus. You can also break it down by public health district. And again, I think that goes to show all the effort that's been put in by most of the partners in our immunization program to really meet people where they are to get the vaccine. One, I just want to go to the state's website and kind of put another plug in for that. If you go to coronavirus.idaho.gov, that's where both the vaccine dashboard is found as well as the cases. Dr. Hahn showed these earlier, the ICU cases, again, sharply increasing across the state. Again, our area is slightly, looking better than that, but it's still concerning. One thing I wanted to just highlight on this page is they've added the mean age of cases admitted by week. And you can see that that has decreased over time. So they're watching that as well. So questions, I know that was a lot. I didn't mean it to just come across as a whole bunch of information, but if it brought up questions, I'd be happy to answer those at this time.
We appreciate all your work, and because of everything that your team has put into this, we do have the information now, which we were lacking a year ago, right? We really didn't have quite as clear a picture, but now we know. So are there questions?
Chairman, go ahead, Greg.
Go ahead, Commissioner Shenton.
For testing? Casey said, or did I miss?
So Casey mentioned that Teton Valley Health specifically kind of started running short of supplies, specifically the Abbott ID Now. That's kind of the 15-minute PCR test, if we recollect from way back when that was kind of first introduced. It's a good one because it's a PCR test, which is better, and it's a kind of rapid on point. They don't have to send it off. Those have become slightly restricted, but no, we still have adequate testing for anyone that wants to be tested. And we can help facilities access testing. It may not be that Abbott ID Now, but it certainly can be an antigen based or a PCR based that's sent off somewhere.
While we're talking about testing, I just wanted to share that the Department of Health and Welfare has made available the Vault saliva-based test available to anyone at no cost. You can call the Idaho Care Line at 211 and request one of those tests, and it will be mailed to you. As well as in our health district, we do have those tests available as well. And if someone needs one, they can just call our office at 208-533-3219. And they will talk to one of our disease investigators, and they will get them that testing resource.
Yeah, those are free to the individual, and the packaging that's sent off is free as well. So no cost.
Okay, thank you. Commissioner Mendenhall, did you have a question?
I did. James, could you help us? Part of our push even now is on education and promotion. And we had that issue a year ago that people were relying on opinion and just things that they've heard or read from sources that may not be reliable or may in their minds. Can you tell how many people are accessing this information? How many hits you have on this information? Can you tell so that we know, is the public using this? Is the public informing themselves? And that's been one of our big pushes, I know.
Yeah, great question. Yeah, we do have that data. I don't have it right at my
No,
fingertips
I
right
don't
here.
need it.
but-
I just wondered if you
Yeah.
could tell how many.
Yeah, and I'll just tell you, before we switch to the BI dashboard or Microsoft BI, we had Tableau, and I can tell you that our Tableau count, because it displayed it right on the bottom, anybody could see it. It was very active, and a lot of individuals were utilizing that. We have to do it a little bit different way through Microsoft BI where we switch to that. It's been a good switch. It's more interactive, and you can do some things and more instead of static that Tableau did. But again, we have to go about it a little bit different way. So I don't.
Okay. Thank you. Yeah, and I think the dashboard is phenomenal. One question that I had, and I mean, every day I look to compare breakthrough cases to total cases, and I'm
Yeah.
watching it very close. And it is crystal clear that the vaccine is providing a great deal of protection. You were looking for the 1 month, and that's what I'm always doing, is breaking it down into dates.
Yeah.
If you go 1 month, I've got mine up here. There were 210 breakthrough cases, and in that same time frame, there was 1,124 total cases. There were 8 people hospitalized in the last month on breakthrough, and there were 62 total individuals hospitalized. So, I mean, it's very clear that the vaccine is providing a significant benefit. With that said, it does confuse me a little bit of why we are seeing hospitals being overrun again, and we are seeing this same curve,
Yeah.
if you will.
Yeah. You expressed my thoughts quite well, actually, because I've had the same concerns. And we're certainly looking at it. And really, there's two options. One, I think the more plausible one, because we would expect to see, with about 50% of our population vaccinated, you'd probably see, if the vaccine wasn't working, kind of on a rudimentary basis, about 50% of the cases as breakthrough cases. That's not the case. I don't know what that percentage is, 210, 15%. So you can see kind of just rudimentary that it is helping. What we can't necessarily do is look, on an alternative timeline, so to speak, or a counterfactual. We can't go back and say, hey, if we were experiencing this same thing without vaccines, although we're still on a similar kind of trajectory, it's lower. Would it be even higher without the vaccine? And I think, sadly, we don't know that, right? We can't say that. Do I have a concern that it's not as impactful as we want it to be? Kind of to your question, yes. But I have to trust that data that's showing, kind of just even on a rudimentary level, that anybody can kind of see the vaccines are, for vaccinated individuals, the case counts are not nearly as high. And it's only recently increased as cases have increased, and the Delta variant is here, as well as maybe time since vaccination. We always thought that there would most likely be a booster dose similar to kind of a flu. How often that would need to be, we're not know. And the best timing of that is still yet to be known. And again, there's so many things we don't know about this disease still. We're 18 months into this. We know a lot more. We have a vaccine. We have ways that we can help mitigate it, and some good treatment options that Dr. Hahn talked about, that we appreciate our hospitals taking advantage of for the benefit of our community. But there's still a lot we don't know.
Yeah, I understand that. And it is clear. And I think I also compare ages. And if you look at the cases recently, the ages are much less, right? I mean, we're
Yeah.
not seeing it amongst the older generation because we have a higher percentage of vaccinated in the older generation.
Yeah.
So it's very clear, but it is discouraging that we're still seeing such a high rise.
Yeah.
But again, I go back to if that percent of vaccinated individuals carried clear through the age groups, we
Yeah.
would not be seeing this, in my estimation.
Yeah, it's certainly, the herd immunity, we heard a lot right as the vaccine was coming out, and it may have been overplayed slightly about how the herd immunity term, but in general, the higher the population of vaccinated individuals, the less likely that virus or disease has a chance to take hold and replicate inside, right? Because you have protected individuals. So the higher we can move that number, the less likely we are to see even the breakthrough cases because, it's
Yeah.
being protective.
Thank you. Are there other questions before we move on? Commissioner Dance?
Commissioner or Chair, is there any data on a percent of the population that choose not to receive the vaccination?
So will you rephrase that again or just re-say that again, please?
Is there any data on what percent of the population chooses not to be vaccinated?
Okay, yeah. So, well, right now you could just take the flip side of who's been vaccinated, right? But I think your question is, are we just missing a portion of the population that wants to be vaccinated and has not yet received it potentially?
Actually, I'm looking for the
The
population that says, no,
No,
this is
not
all
really.
bogus.
So there has been some surveys and some studies done in the state of Idaho. And depending on the timeline and who did it, anywhere from 30 to 40% said, we're not going to get the vaccine.
Interesting.
Again, that wasn't necessarily by region or county. That was kind of across the state. And I don't have
That's
those data studies in front of me to really delve into that. But from what was reported to us, anywhere from 30 to 40% said, no, we're not going to get the vaccine.
Thank you.
Are there other questions? Yes, Commissioner Mattson.
Is there any studies on that? They call them long haulers or that they have long-term effects from COVID, and if they should be vaccinated more regularly or things like that. I mean, because we have a few in our community that have that. So
yeah,
just kind of curious on that.
yeah, that's a great question. So regarding long haulers, they would probably still be put into that same category of previously infected individuals. And we do recommend that they get the vaccine. The best timing of that, we still don't know. So we just make a general statement of, if you've previously been infected with COVID-19, please consider still getting the vaccine for an additional benefit or boost to that immunity and potential of availability of more cross protection to other variants. So the long haulers would fit into that. They are not necessarily at any more risk just because they've had symptoms that have consistently lasted longer and have had, kind of those long effects happening. But again, we certainly, due to their experience with the first time around, we wouldn't want them to be reinfected. So they would be highly encouraged to get the vaccine.
Are there other questions? Okay, seeing none. Thank you for that
Thank you.
report. We appreciate all the work that your group has been doing. We'll move to our Director of Clinical Services, Amy Gammett. Thank you for joining us, Amy.
Thank you, Commissioner. Can you guys hear me?
Yes.
A lot of this will be a little bit of overlap. I appreciate Dr. Hahn and James both as well. And so, Jerry, let's actually jump to slide 9. We'll try not to belabor some of that there.
You'll have to tell me where to stop because I don't see a
Oh.
slide number.
Okay, it's on 2 more.
One more.
Actually, 1 more. So right there, I tried to blow up just the county specific data. And I think this is yesterday's, right? It's still, Jerry, because I actually think Teton County hit 60% today.
Oh, yeah, I didn't update that,
Okay,
that
that's
particular slide.
That's okay. But you can kind of see our statewide and health district wise, Blaine County has been the highest vaccination rate across the state from the get-go versus Idaho County, almost a 60% difference. And that's just among the counties. In ours, Bonneville, I think they're 55, 56, up to Teton County, 59. Jefferson County is currently our lowest 12 and up vaccination rates. And again, you guys can go in here anytime and look at that age groups or overall 65 up as well. So I encourage everybody to do that. Next slide. And next slide. Some of these are overlaps, so I'm not gonna cover them. Just again, you heard a little bit, James, just kind of give the detail on that additional dose. This is one of the phone calls that we probably are receiving right now the most. That current extra dose is just that. It's for people that likely the vaccine didn't work on the first 2 vaccines, so they're recommended to have a third one. That's different than somebody that's not immunocompromised, like myself, that the vaccine's waning. So it worked initially, but now it's wearing off. When do we need that booster dose? In ACIP's meeting last week, it was the first time I actually seen them presenting a lot of data around neutralizing antibodies. So that antibody level that everybody's been trying to get to, even, at work, we've had this conversation multiple times. What's that magic number of when I'm immune? Whether that's from a vaccine or because I had COVID disease itself. And so we're starting to see, some of those numbers coming out, looking at what somebody's neutralizing antibody level was when they had a breakthrough case or following months after COVID infection. And so that data coming in will help us determine those additional booster doses. And then again, how soon after COVID disease that you'll need an extra dose as well. Next slide, Jerry. Next slide. A lot of these Dr. Hahn covered. Some data when you look down at the third bullet point here, how well the vaccine works on somebody that's immunocompromised. Most people, it's around 90 to 94% versus 59 to 72%. And so as much as, 40% of severely immune compromised people, that vaccine doesn't work as well with the first 2 doses. And so they're showing if they can give them a third one, they're seeing a boost or seeing any circulating antibodies up to a third to a half with that third dose. So they're just trying to give them another opportunity at protection. And this is also why you're still seeing people that, they're still recommending masks for these individuals as well, and still doing all those other, mitigation things to prevent them from getting COVID, even though they've been vaccinated. A lot of them, again, as many, as a quarter, when you start to do the math, may not be protected after 3 doses of the vaccine. Next slide, Jerry. This moderately to severe also was other confusing as who that did cover. It was about 7% of the US population. And so these are a big immune compromised people, cancer treatment, people on any sort of therapy that decreases their immune system, people with HIV, organ transplant, stem cell. And so these are the people that we're providing that third dose for right now. Next slide. So what about the other one, the actual, what we would consider the booster dose? And again, that's what they're currently reviewing. I think you see, Dr. Hahn mentioned that the White House came out with that. CDC and ACIP would like the data to support that as well. And so they're looking at how long after vaccine or COVID is that immunity waning? Is it safe to give an additional dose? And then how much of a boost do they get? And so, yeah, we're also suspecting that an actual booster dose will be recommended, in September. They do meet again. ACIP, Advisory Committee on Immunization Practices, does meet next week. And I'm suspecting that we'll see additional data around this recommendation next week. Next slide. This was a postcard that we put together here at Eastern Idaho Public Health. There was a concern that individuals didn't know where to get a vaccine. We put this together to make sure that everybody knew they were eligible for vaccine. We're one of the only few places that you can call to make an appointment. The majority of places, in some counties, we're the only place you can call. In other places, you have to do that online. So we wanted to make sure people had our phone number to call and make an appointment, to call and schedule a special clinic, let us know if they couldn't get to a clinic, and so give them access. And so we did send this postcard. Hopefully you guys all received one. Sent this postcard out to all 8 of our county patrons. Spanish on the other side. This is the English side, but it was in Spanish and English. When we sent that postcard out, I wanted to know if it was a mechanism where people would respond to. So we did start asking the questions during those appointments, how they heard about our clinic overall. And we see this in our other, when we do other request information, we see this for other programs as well. Number one, always is friends and family referral, many returning clients. New, just because we're in the news all the time, a lot of people have just heard, the health department did COVID vaccine, so they looked up the number and found us. I've been surprised how many doctors' offices and pharmacies are referring. I'm assuming a lot of these pharmacies must not carry the vaccine themselves. And then the postcard as well were the top 5 answers. The other ones on the bottom were less, Facebook, our website, online, college has been referring people as well. Next slide. I also was interested in the last month or so, wondering what motivated them to be vaccinated today. I think somebody had asked that question. I wasn't sure which commissioner it was about, who's not going to get it. And all along, even before vaccination, there's been national surveys out there saying, this percent says they're going to, this percent says they're on the fence, this percent says I'm never going to get it. And then they've been looking at the bar of that. So the people on the fence, which way did they move? Or those that were never going to get it, did they move to on the fence? And so we're always looking at that. And so I want to know, especially when we were seeing somebody that was 70, what motivated you to have the vaccine in July versus back in February? And these were some recent answers. Afraid or concerned about Delta. Number one, a lot of people were waiting after summer vacation. If you're going on summer vacation, you were probably at higher risk when you were out and about, but a lot of them waited till they were back. School starting seems to be a motivator. And then a lot of people travel, work is requiring it. Still conversations with a family member. I just had a daughter that listens to me all the time, just choose to be vaccinated, a couple of weeks ago. And she said, just a conversation personally with me. And then more people seeing the vaccine being done. And so these are the main responses that we're getting the last probably 6 weeks from them. Next slide. Just letting you know what we're doing here. We're continuing to have clinics in all of our counties every week. We're seeing more workplace clinics. A lot of people are already asking us about in conjunction with flu clinics when we come back. Many workplaces that we went to are calling us back to come back. And a lot of that is they have additional staff that are now wanting to be vaccinated that passed on the first go around. Next slide, Jerry. These are some off-site clinics that we've also been doing. We've done a county fair, did the Idaho Falls Duck Race. We've been working with the Housing Coalition. They're going into places where we have low-income housing and sponsoring basically a vaccine clinic. And then anybody around there. The first one was in Madison County, so a group of apartments in that same block. We called it a block party. They had an assisted living and then actually some college housing as well. And so we invited all of those at that. We have several more of those coming up. We're currently doing back to school immunizations. We didn't get to do that last year. Going to schools, and most of our school districts, we did, ask the school district to allow us to provide COVID vaccine at the same time. Parents are at these clinics. I'm only aware of one school district that said that we couldn't do that, but we're giving a lot of COVID vaccines at those school clinics. That clinic that didn't allow us to bring COVID vaccines, we had several requests for it. In fact, one mom was very upset that the school district had chosen not to have COVID vaccine at the same time. on that. Next week, we're going to District 91 back to school. We're going ISU back to school event, and then, you know, some of these others. So we're trying to give everybody an opportunity to have vaccine available where they're at as we can. So very busy. I would say staffing, same thing, just like the hospital and everybody else reporting, is just having enough nurses to do all these events for the long haul of this. You know, a year later, you know, maybe some of those part-time temps that we had early on a year ago when it was exciting and new out, you know, that they're tired and not as involved. And so same as everybody else, you know, staffing right now is our biggest concern to provide all these clinics. Next slide. Oh, I guess that is the last slide. And then any questions?
Questions? Not seeing any. Thank you very much. Very informative. We appreciate everything you're doing.
And if I may just say, James mentioned it earlier, but our immunization staff has been incredible. When you look at the work that's been done by local public health districts across the state, our health district is far and above the leader in immunizations, doing probably close to 60,000 COVID vaccinations since it first became available in mid-December. And that's a credit to Amy and the great team of employees that we have at Eastern Idaho Public Health. So I just want to share my thanks as well.
Thank you, Jerry.
Thank you. All right. Thank you, Amy. Appreciate it. We'll go ahead and move to our director, ongoing response.
Well, we wanted to maybe talk a bit about the COVID data tracker. There's, back in June, we retired the response plan that we had for our region. And a few weeks back, the CDC came out with new recommendations. All along, we've been promoting individuals follow the CDC recommendations for masking and physical distancing and vaccination. And because of the increase in cases across the nation, new guidance was released by CDC that recommended that people that live in areas of high or sustained transmission, even if you're vaccinated, to wear masks indoors. So we wanted to talk about that data tracker that shows some of that information. Certainly, we have received inquiries from people that are confused about the CDC level of transmission because it is different from what we had in our regional response plan. And if you recall, early on when we were developing that plan, our numbers were higher than what CDC was using to determine the level of transmission within a county or a risk level within a county or a region. And that was done with intention, with conversations with our hospitals, and really trying to determine at our local level in our region the resources we had available. And that's how we come up with our regional response levels, our risk levels. So people are confused because, while we don't show those risk levels anymore, people are familiar with it. And as from Lemhi County in particular, I had a conversation with some community leaders there about, the CDC says we're in high risk level, but if if we were looking at what it would have been for Eastern Idaho Public Health Plan, it would have only put us in the yellow, not the orange or the red. So there is some confusion about that. And so James is going to show information from the CDC data tracker where that information is coming from. And then we can answer any questions about that.
So yeah, thank you. I'll just share my screen here. And you can find this is at covid.cdc.gov, and then the data tracking. Of course, you're also welcome to Google or your favorite search engine to just put in COVID data tracker and you can find this information. And it'll have a snapshot. There's a lot of good information on here, but the Your Community page really is where most of this has. It's got some profile reports as well as forecasting and county views. We'll click into the county view here. And I apologize, because it has a little bit, because it has so much information, it does take a few minutes in between. So you can select your state, Idaho here, and then you can select your county. I'm just going to select Bonneville County.
Up one.
That's frozen. Okay. So it can select Bonneville County, and then you can actually look at the map and okay. So you can choose different items here that you're going to look at: level of community transmission or cases, many of these things. We'll look at community transmission because that's what Jerry just referenced here. I'm going to zoom in just a little bit more back on Idaho. So red being their highest level, orange being next, yellow similar to our plan, and then blue is the lowest level. You can see right now the community transmission from the CDC is just based on two items: either number of cases, and again, this information is found just below here, but number of cases and or percent positivity of tests. So a percent positivity of tests above 10%, regardless of the number of cases, will put you into the high level of community transmission. Or it could be, the high, number of cases being over 100 per 100,000 in the last 7 days. So looking at it slightly different than we did, and kind of what Jerry explained, a much lower level. But again, if anyone's wanting to look in detail, you can scroll down. I apologize, my computer is it's looking a little bit haggard with trying to run both Zoom and this website. But again, you can look and see our area here with Bonneville and everyone being in the red.
So with that explanation of the CDC risk levels and where their recommendations are applicable to at this point in time, it takes us back to our regional response plan. And it was a year ago about this time that we developed that plan because we needed to do something to be able to slow the spread of the virus, because we did not have vaccination. We did not have treatments at that point in time. And you all know the various iterations the plan went through. At this point in time, we have treatments, we have vaccinations. And I think the health district's efforts should continue to be focused on offering vaccine to those that want it, to educating those that may be uncertain still and willing to have those conversations, but really promoting vaccinations. That is the tool that we have at this point in time, in addition to the other mitigation, personal choices for wearing a mask. We certainly encourage people to stay home when you're sick, wash your hands, frequently. All those things that we talked about early on do still help slow the spread of the virus. But right now, the vaccine is one of the best tools that we have to slow things down. So I just wanted to turn to the board and ask for your direction for us as the health department, how we proceed from here.
Board members, your thoughts?
I agree with what Jerry's. The best.
Okay, thank you, Commissioner Young. Other comments or thoughts?
I will just add on to that, the rise in hospitalizations and the stress on our healthcare capacity across the state certainly is concerning. And just this week, in fact, yesterday, there was a call initiated that's now going to be a daily call of hospitals across the state trying to help coordinate what hospital can take a patient in the state, because some are at that capacity level. There's concern in the Treasure Valley, extending some to the Magic Valley and up north, that it could just be a matter of weeks before they are nearing that crisis standards of care level. And that's something that none of us want to be in. It can impact every single one of us that may need hospital care for whatever reason. So I would put a plea out to the public that, first of all, if you've chosen not to get vaccinated and are considering it, to please do that. We need a higher vaccination level to help slow this thing down. Also, I would certainly encourage people to wear masks, because we do have high levels of transmission around the state. And I know there's concern with schools starting, that many of our schools are not requiring masks in the school. We've heard certainly feedback. We have provided resources to the schools. There was a school task force that was convened at the state level that had stakeholders from many groups participate on that. And that toolbox was shared with all the school districts across the state. But again, they are local school boards elected to make the decisions for their districts. But from a public health viewpoint, vaccination, wearing masks when you're in close proximity or indoors, certainly are some of our best way to slow the spread.
I agree, Jerry, and we are at a totally different place than we were a year ago, because we have so much information. We understand much more about the virus. We have treatments for those who are infected. And most importantly, we do have a vaccine that is showing to be highly effective. There will be breakthroughs. We were told from the beginning that it was 95%. I think we're seeing a much higher effectiveness out of it than the 95. If you run the numbers, well, at least we're slightly higher. So we have all the tools necessary. It's just now encouraging and hoping that individuals will utilize those. The previous administration opened all of the regulations and pushed and allowed for this vaccine to come in a record amount of time, but it was because of all the hard work that was put in. If you have been praying and asking for that kind of help, I believe on both cases we have our answer, and it is the vaccine. And it's just important now for the individuals to use that, and if they are able to be vaccinated, I think that's the trick. But for your health department, I think you're doing everything that you can. Are there other thoughts?
I do have one more thought, if I might. The one certainly valid concern that is felt by many is that children under 12 years old are not able to get the vaccine at this point. And that's why the masking in those situations will remain a critical piece of being able to slow the spread until all age groups are eligible for the vaccine. And I would also say that the concern with other illnesses that are being transmitted right now, including RSV, I've had conversations with local physician that talks about the pediatric capacity in our hospital is being stretched tight as well, because of the record number of RSV cases that they're seeing right now. So children, we do need to continue these other things as a community to help protect the children.
I would agree. We're very fortunate that the coronavirus, the COVID-19, did not have the negative impact on young people that it did on the older. if that would have been the case, it just would have been extremely sad. And so, you know, we're grateful for that. But the RSV does concern me. Other thoughts,
Mr. Chairman,
direction from the board, Commissioner Mendenhall?
a couple of things. One, Jerry, when I'm done, this calls from the hospitals and the staff shortages. Have they began to develop their solution, their plan? I mean, there's only so much the Public Health Board, we don't have that input. And so that's going to be an outlying issue that's going to have to be addressed beyond us, way beyond us. So if there are solutions that they're offering, that's awesome. I hope they make them known. I just recall a year ago that we became embroiled in local authority, and we were castigated several times, and very much so, in news outlets and public sentiment as we became embroiled in those local authorities. And I really, because the statement was made, well, we're only following what Eastern Idaho Public Health says, or have you compared Southern Idaho Public Health to what you're doing? And it just, it was a terrible time. And with that said, I don't know if we perhaps need to review or take another look at the language in our regional plan to increase the counsel and advice and push for vaccination. You know, we went from the health order. I still have a hard time with mask mandate. It was a health order. We went from the health order to education. And I'm wondering if perhaps this board, where we can encourage vaccination with all of the information that's been put out, it's a different time than it was a year ago. And I don't know what, I did not look at the language, I admit, of what there was with that past order. And I don't know if we need to revisit that to reemphasize that we're in a different time. We're in a vaccination period, not as much of a stand 6 feet back. And yes, wear your face covering and wash your hands. We'll still do that. But I don't know if we need to add to it the importance and the push of encouragement of vaccination. I don't know. And so I just put that out there. I don't want to become embroiled in the local authorities. I sat in Capitol for a day in Rexburg with the governor was there, and one of the questions, and he got beat up pretty good about, are you going to force schools to close, to have mask mandates? And he said, no. He said, that's the local authority. And I want to make sure that's crystal clear. But then some of the school districts chose to say, well, we're just following what Eastern Idaho Public Health said. And I looked at that and I would go, we didn't say that. And so I kind of want to make sure as we go into this next phase of the Delta variant or any variants, the vaccination is showing to be a slowdown mechanism. It's not the cure-all, but it's a slowdown mechanism. I don't know. I just throw that out because I want to go into this letting people know from the front. Yeah, you follow Eastern Idaho Public Health. You're probably going to need to follow what we say. If you choose not to, you made a choice. I just put that out there. I don't know.
Thoughts? Thank you. Thank you. And I do not disagree.
I don't know if we need to revisit the language of our plan, the direction of our regional plan. I don't know if it has taken on a different, I don't know.
Well, our plan is retired, so we're not even using that plan at
Even
the
more
present
so,
time.
maybe. I don't know.
So I can just tell you that we continue to educate about vaccines. I want to give a huge shout out to Mimi Taylor, our public information officer, that has been a superhero in my book as far as the social media, that every single day for many months now, providing information and education about vaccines and how people can access them and where they are, and they're free, and the safety of them. She's been on a much needed, very well-deserved vacation for the last week. And so we've had a hiatus on the daily encouragement of people to get vaccines, but through our offices every single day, we're doing that education. So we certainly will continue that. We could provide more information to the school districts on the vaccination piece, for children 12 and over. We're working with businesses. We continue to do that. So if there's something really specific that you have in mind that you would like us to do for the vaccine education piece, we're open to hearing that.
Mr. Chairman, I don't. I am trying to deflect to that statement, that worn out phrase, we're following Eastern Idaho Public Health with no further comment of what are you following? If the Eastern Idaho Public Health says we are following CDC guidelines that change weekly, then they get confused and yeah, the plan has been retired. I just want us to be proactive, and you are. Public health is. When they say that board is not doing anything, I want to be able to say, refer to what the public health office has put out. So that would be the end of that. And it's true. The public relations has been awesome with vaccinations. So I don't have anything in particular. I'm just looking at this as we go into this next phase, that we are prepared as a board. We've already received a few emails, accusations, you're not doing this, you're putting people's lives at risk. No, we're not. And I don't know what those what it's based on. I don't know, but I want to make sure that we are doing what we are doing. Yeah.
Well, and I want to go back to what I said. We're at a different time. Everybody knows the proper things to do now. Everybody knows how to stay safe from it. They know they'll either agree or disagree with the effectiveness of masking. They know it's been pretty clear from last year that it was effective. They know that the vaccine is available to them. The data is crystal clear of the effectiveness of the vaccine. Everybody knows that. So I don't think that we need to come out with more than is there. The public knows it. A strong vaccination campaign will continue, I'm sure, from Eastern Idaho Public Health. As our director said, we're leading the state in the work that is being done to get vaccinations out to all the communities. And so I believe that Eastern Idaho Public Health is doing everything that can be done. And if someone feels like we're not out there doing it, they're just not seeing it, and they're asking to be compelled in all things. That's no longer necessary. They know the information.
So, Mr. Chairman, where this is a public meeting and there are people viewing, thank you. That's what I needed to come from. This is a board meeting, the first one we have had like this, and with this increase and with the notoriety of COVID on the increase, we let our guard down for a little bit and a variant comes in. I wanted for the public to hear, and whether it's news outlets, whatever it might be, just what you said. And I wouldn't ask you to repeat that again. It was strong enough, but we know that it's a vaccine campaign and they know what they need to do. And I think that's simple enough without another plan. Just wanted the public to know that we are discussing and that we are aware, and we have a force behind us that is pushing this from a health perspective.
I think it's pretty clear that activities are going to continue. Schools have to continue. We cannot put our children through what they went through last year with schools. And so they're going to continue. They're going to have activities. Our lives are going to move forward. And if people want them to get more normal and to have us quit spending 2 hours on this subject, which troubles me. After this long, it is not necessary for us to spend 2 hours on this subject. We have the vaccine available and it is working. All we need is for a greater percentage to receive that, and then it will help protect the children in the schools who aren't eligible for it, because we'll lower the load out in the community. So that's what has to be done. And it troubles me that we're not already doing it.
Chairman.
I'm sorry.
Yes, Commissioner Shen.
Well, I appreciate what you said. I agree 100%. I couldn't say it the way you did it, but also Amy's presentation I mean, hit everything on the head. She was meeting with schools, mailing things out. I think we're doing a great job.
Well, I just want to add on to that. I think our media partners, and we have the Post Register in the room today, has been very engaged in providing information to the public on every single topic around COVID-19. Covers the media briefings that are done by this on the state level. So not just I call that Post Register, but every single one of our media partners, Eastern Idaho News, our television stations, have helped us in getting people education and information.
Okay.
So thank you.
Yes, thank you. Any other comments before we move on? We are a little bit late in our agenda.
Oh, I would just to say, to kind of sum up, I think we've moved to the point where we no longer have a big knowledge gap. We have a huge behavior gap.
Yeah, thank you. That was that is so true, and that was from our fiscal officer Stephen Thomas, who is in audience with us today. So we'll go ahead and move on.
Chairman, before we do, I noticed on the agenda that it had parenthetically an action item. Was there an action we needed to take there?
It was just if the board were to direct some action to come out of this, it was the opportunity for that to happen.
Okay, thank you. So we'll go ahead and move to our director's report.
All right, just maybe to frame the rest of our morning, we do have to conclude the business portion of this meeting probably no later than 11:20 because we have the Region 7 Behavioral Health Board that begins at 11:30, and that will be, our board will participate in that, but we have to cut this part off to get that piece going.
Okay.
And I think most of these other topics are fairly quick. So
Okay.
just to give you an idea of what I'm looking at, let me get to, if I can, back to our website. So the next item on the agenda was the recruitment of our physician for our Board of Health. And just pulling up the agenda so we have it here. As we know, Dr. Nelson ended her term of 15 years on our Board of Health at the end of June. At this point in time, according to our bylaws, we've never had to do this. In my tenure, we've only had one physician on our board, and Dr. Nelson was the inaugural physician. So it's outlined in our board bylaws that we will send a notice to all the physicians within our district to make known the open position on our board. I have a letter drafted and ready to go, and we will be obtaining the mailing addresses for the physicians in our health district, and we'll get that letter out in the next day or so. I also plan to put it in the media. I had a press release prepared based on discussion for today of the next steps, and through our social media, just so it's widely known that we are recruiting a physician. What I would like to propose to the board is that we have a small selection group, and I would suggest that it's the chair, the vice chair, and potentially one other board member that could review any applications we get and bring forward a small list for interviewing at our September 16th Board of Health meeting.
Okay. Your thoughts on that, board members? And I guess I would open it up with who would like to serve on that committee as a general board member. Commissioner Dance?
One question, Director. Have you had any initial potentials make contact with you?
I've had a conversation, and we've had a couple people reach out in other means. So I'd say a handful of physicians have inquired or asked about it. So
Express some interest.
yes.
Okay. Thank you.
I anticipate we will get, and the committee will narrow it down to 2 or 3, depending on the amount of applications that we get to
Sure.
then present to the board in our September meeting for to be able to visit with them at that time and make a decision. Any thoughts? Does anybody?
I would.
Commissioner Dance, would you like to
willing
serve
to
on
do
that
so.
then? It'll be Commissioner Mendenhall, myself, and Commissioner Dance in. Is there any objection to that, by other board members? Okay, we'll go ahead and move that direction, and we hope that I'm sure that we will get a lot of interest, and we would benefit from all the positions in our area that have a desire to serve. We would benefit from all of them, wish we could, and that may be a good reason to rotate them. We were very fortunate to have somebody with the public health knowledge of Dr. Nelson, and benefited from her for a long time. But I think it's good to get. It will be good to get more information from a larger group, and so we'll look forward to who applies.
And just for clarification for the board, as it's outlined in the bylaws, will select the position, but then that appointment, I guess, needs to be ratified by all the county commissioners within our health district,
Yeah.
just like any board member position is.
Right.
So we will get that out in the coming days. Just quickly, an update on House Bill 316. The district directors met in Boise a couple of weeks ago. We had the opportunity to meet with many of the state agencies in which we are intimately involved with our daily operations. That included the State Controller's Office, Idaho Department of Health and Welfare, the Director of Department of Environmental Quality, the Office of Group Insurance, and the Division of Human Resources. And we began dialogue with each of those agency directors as to what it looks like moving forward with the change outlined in House Bill 316. We had some good conversations. We don't have all the answers to what that's going to look like going forward. At this point, there's still quite a few questions related to the Division of Human Resources of what that will look like with the new language in House Bill 316 that gives the board the ultimate authority over the decisions of personnel, which is a little bit in conflict right now with the rules of the state that say we have to abide by the Division of Human Resources rules. And so there's conversations going on about how what changes may need to be made resulting from that. We have a joint meeting with the State Controller's Office and the Division of Human Resources coming up in the next couple of weeks to continue those discussions. But I just want to let you know we're having those discussions, and as more information is gathered, I'll report back and seek guidance from you all.
Okay. I'd like to ask that we move the next item, the discussion of the Idaho Association of District Boards of Health,
Absolutely.
to our September meeting. Hopefully we'll have Mr. Lake with us in person at that time. And with your permission or no objection,
That's fine.
let's go ahead and skip to the HVAC.
Okay. In this building that we're sitting in, we've had some significant failures of our heating and air conditioning system. We have 24 rooftop units that sit on this roof, and they've been here since we built the building in 2007. 3 have completely failed. And as we were talking just preliminarily with some providers of what we were looking at for replacement costs, as well as the historical unhappiness with the HVAC system in this building, we are moving down the road of looking to actually replace the entire system. We did select a mechanical engineer to work with us to help design what a more functioning system would be for this building. That was a 10-week project. We're halfway into that. So that puts us to about the end of September, when the latest that we should anticipate getting the project design from the mechanical engineer. In the preliminary discussions, just to replace the units, estimates was close to $300,000. for all the units on this building. I anticipate with us redoing some of the control systems that it could be to the tune of $400,000 or even more. Because of the cost of the project, we do have to go out to public bid for 30 days. And so I anticipate that the timeline being the end of September till the end of October, when we would be ready to open bids for the project. So because of the cost, in our budget, the board has authorized $250,000 of funds that is set aside and authorized for me to spend on building needs. Some of that is being used up by the mechanical engineer. And so I need to ask direction from the board of how we proceed at the time that we get to opening the bids. The two options I would put forward are the board could authorize that at today's meeting that we go through that bid process and authorize me to accept the lowest bid and spend that money out of our reserve account. Not what's already in our operating reserve, but just fund the project cost out of our capital reserve account. Another option is that we have a special board meeting that could take part in the opening of the bids and authorize the expenditure at that point.
Yeah, I guess I'd ask some direction of the board. I would lean to spend it out of the reserves to keep the capital reserve intact in case something came up and you wouldn't need authorization. You would have that then. That
I would need
correct?
authorization to fully fund the cost of the project, authorized to spend funding. And we would have some of that funding in the operating reserve that's already authorized now. But I would suggest that we say we take the entire amount out of our capital reserve account and the board authorizes me to spend the cost that comes in with the low bid.
Yeah, that's what I was trying to say. Any other thoughts?
Rough balance, Director of the Capital Reserve Account.
I can pull that up right here. Just give me 1 second. That's on a little bit later. We haven't come to it, but it is, unless Steve can say off the top of his head.
Okay. And the building reserve, $1,387,000.
Thank you.
We have known this was coming, and so we've been somewhat planning for it. It's going to be a little more than we had anticipated, but that's generally what's going on now in any type of construction. So thoughts? If not, I'd entertain a motion. Commissioner Mendenhall?
Precursor to that, impressed with the operations of the building, finances, and the direction, and have full confidence and trust that it will be spent wisely. And so I would make a motion that we, I'm trying to remember
Capital
what you
reserves
didn't say and
account.
what you said, to take it out of the capital reserves to replace the HVAC and go with the low bidder.
Thank you. I struggled for that
And
word
give
the first
the
time
authority
too.
to do so.
Thank you.
Okay. Is there a second?
I second that.
Okay, thank you. Commissioner Butts, this is a second. Is there any discussion? Seeing none, all in favor, say aye.
Aye.
Anyone opposed? All right, thank you. We will do that. So we will move next to our environmental health. It looks like we have a couple items discussed there. So we welcome our Division Director, Kelly Johnson.
Morning. I wish I had a little bit better news to be coming to you today about, but it's been a few years since we've had to go through actual legal proceedings in our septic program. But as of this week, I just notified our legal counsel that we need to do so again. We have a situation where we have a property where an illegal replacement drain field has been found. Staff and I have tried to work with the property owners to mediate the situation in hopes to have the system actually installed properly with a permit. And it's unfortunately come to no avail. So we are having to look at now bringing to the board a legal action. What we do is we invite our attorney to try to get the property owners to come in and meet with the board in hopes that with one last effort before actually having to go to court, that we can mediate the situation. The situation on this one, unfortunately, is we are dealing with a property that is potentially up for sale. So time is quite critical. The renters have been very cooperative. They were actually looking at maybe trying to do the work themselves to try to take care of things, but that's kind of come to a close as well, just due to the fact that the property owner ultimately is responsible. And obviously with the renters, in hopes that the property owners will take care of things so the cost doesn't fall on them. They actually had witnessed the illegal system being installed. So we do have, good reason to go forward, knowing that the illegal system has been installed. It's undersized. We're dealing with potentially high subwater areas. So the concern is what was installed, could fail at any time and contaminate the groundwater if it's not already doing that already. So it is a very strong public health concern. So our attorney will be moving forward with preparing the letter. I'm surprised I haven't seen it this week already, but I know that they have their own situation of cases to work with besides our own. But that will be upcoming to the board unless his letter helps to actually spur the property owner to work with this as we had hoped that they would have done by now. We actually have had an application turned in, a fee paid, but nothing else to move forward. So we do need to have a test hole so we can make sure that we know where the groundwater, subwater level is. So when we write the permit, it's going to be the proper sized permit, the right depth allowed. And so there are some steps that still need to be taken place by the health district. Again, hopefully with the property owner working with this, once they actually have received one letter already from our attorney. When I had actually gone on site, tried to work with the property owner to take care of this. Unfortunately, things stalled out. So knowing again, the sale of the property is at stake, I asked the attorney to already write one letter, and that unfortunately did not have any outcome in the positive direction. So we're now moving forward. So what happens is the board will be asked to, again, hopefully meet with the property owner. Our legal counsel will be present and hopefully come to terms so we can get this taken care of. But if they refuse to show up, then we will have to make that decision to go to court with the board's permission. We're showing today the natural appeal process that we've only in my 20 years as environmental health director have actually had to go through an appeals process where somebody from the public, if we are giving decisions that they're not happy with, that they have a way to appeal to first myself from an employee's decision. Then if they aren't happy with my decision on my staff's actual decision, then it would go to our director. And then at that time, if they're still not happy with the decision, it would go to the board. I'm not exactly expecting this to happen with our legal situation, but we wanted to let you know that an appeal process is out there if they should question why we're doing what we're doing. At this point, the individual of the property owner has not reached out to say that they're not questioning what we're doing with the legal action, but we wanted to let you know that this appeal process is in place if that should come up as well. So if there's any questions, I'd be happy to answer them again. Something I was hoping wasn't going to happen, but we are at that point now with legal proceedings.
Are you anticipating some action from the board before our September meeting then?
It would only, depending on what our attorney can do to hopefully get the individual to respond to his next letter in hopes that he would be willing to meet with the board if they're questioning our process. Again, I'm hoping the letter that will go out very shortly will actually prevent this from having to occur, but just wanted to make you aware that we're into now attorney funds being spent and potentially court costs if we are having to go that direction.
Okay, thank you. Are there any questions? On the board? Okay, thank you. Director, do you want to defer our fiscal report until after the behavioral health meeting?
Actually, I think we could defer item 6B. That is not urgent to be done today, and we can put that on for September. I pulled the financial report out of the consent agenda because we were going to be talking about our overall reserves and how we might invest that differently. So we don't really need to talk about either of those things right now. If it would be okay, I just asked Steve to give a quick update on our current audit.
Okay.
You need to come to the microphone.
Thank you, Stephen. We'll ask you to be pretty condensed.
They started in June and they're still working. We don't have anything specific back from the auditors other than they both done the over by the end of September.
Okay, that was very condensed. So really not anything definitive yet as far as the audit.
No, we've not been made aware of any concerning issues found up until this point. So just a very quick update, and as we have the final report, we'll bring that to the board.
Okay, thank you. We will look forward to your full report in September then.
An update.
Okay.
Historically, from when they first start till finish, legislative audit services has taken between 6 months and 18 months to come up with a final report.
Okay. All right, thank you. Are there other items, Director Rakow, that you need to cover before?
No, they're not.
So we do have next on our agenda, the Region 7 Behavioral Health Board meeting. Commissioner Mendenhall and I are actually members of that board. That board deals with items that this board as a public health board should be very familiar with and interested in. And so I appreciate you putting this together and the opportunity for our board to be able to participate and witness that.
Yeah. If I may just add a couple more things. It was in 2015 that the Idaho Department of Health and Welfare Division of Behavioral Health came to all of the public health districts across the state and asked for our willingness to be the fiduciary party on behalf of the behavioral health boards. So we do have a sub-grant with the Division of Behavioral Health that funds the work of these boards to the tune of $50,000 a year. We have myself, Mimi Taylor is the liaison between the health district and the board. And then also Cheryl O'Connell, our staff member, takes the minutes for the behavioral health board meeting. So we provide just the financial oversight and facilitate the process with all the finances, but it is a separate independent board with 22 members, and again, with 2 of our board members sitting on that.
Okay, so how is this going to work then?
Okay, so I would propose that we end the live stream of the Eastern Iowa Public Health Board meeting. The Behavioral Health Board meeting is accessible by Zoom, and that link is on our website at eiph.idaho.gov. The meeting starts at 11:30, and so we'll take a quick break and then just resume on that meeting through Zoom and conclude our board business.
Okay, so board members, you've got just a few minutes here to take a break, and then we will log on to and we can just do that from our own seats with our own computers. We will log on to the Behavioral Health Board meeting here at 11:30. So thank you. Let's take a break then.